You're not the nurse practitioner. You're not the physician assistant. If they say, oh, you can make the correction. No, you don't. You need to do that. Especially if it's in the EMR. Again, what happens if you make that? It's called what again? IP address. IP address tells us what? Who, what time, what day, what computer, who did it. It's going to have your footprint, your carbon footprint. There's no way around that. So please do it. Please don't do it. Okay? Now, this is called an addendum. Now, let's just say, oh, I hurt myself. Got some sharp nails. I didn't know my nails were that sharp. Okay. All right. So in the SOAP notes, and where do we live in the SOAP notes? Then the assessment. Oh, very good. I think I'd wore y'all out pretty good with that. Okay. And in the assessment, you have what codes? What are the two codes you have in the assessment?
Diagnosis and procedure.
Diagnosis and procedure code. Okay. So let's suppose that the doctor wrote bronchitis. The patient had bronchitis, modern decision making, straightforward, high complexity. Okay, so we're going to say with these variables, this is a 99203. Okay, he spent a good amount of time with this patient. Okay, and the diagnosis is bronchitis. But he realizes and says, you know what, hold up. I reread my notes and my thoughts, and I reread what the nurse said. So why did I say that? Doggone it. Somebody was talking to me while I was trying to think of the patient situation, and I got it mixed up with some other patient. Oops. So now the doctor needs to come back and make a correction. In paper-based medical records, this is how the addendum is done. Even even in acute care settings. Acute care mean what?
Inpatient.
Inpatient, very good. So you're going to circle the error. You're going to cross through it. Suppose I'm the doctor. And I'm going to put my initials here, TNH. And today's date is 4/24. Thank you. 4/24/19. And the correct diagnosis is asthma. Does everybody understand that? All right. That's how you do that. Why? If the doctor does it, or the nurse or the nurse practitioner does it, it is considered to be a what? Legal and what? Binding what? Document. Medical record. That can be subpoenaed by law to the court by way of the judge any time. Now, let me ask this question. I think I said it earlier. Do we use liquid paper?
Glad you asked.
You glad I asked. Okay.
No.
No. Do we use correction tape?
No.
Do medical billers and coders make the correction? Who makes the correction? The doctor or the nurse practitioner. Why is that? Because it's out of our what? Scope. It's above our what? Pay grade. Okay? All right? I don't care if they decide to give you a $5 an hour raise. I don't care. That's still above your pay grade. That's out of your scope. Don't let folks bribe you in the doing era. Okay. Does everybody got this? Okay. Very good. Very good. I'm glad y'all got this. Legal and binding documents. All right, me loves. Who was the last one? Ashley? Okay, Brenda, read the next one, please.
Name the 6 documentation components of a patient's history. Chief complaint, history of present illness, review of systems, past history, family history, and social history.
Very good. All those components make a big deal on how the doctor judged the patient. Let me erase this. Let me make sure all this get on the YouTube. It's all on the tube, on the tube, on the tube, on the tube. Okay. Now I'm going to erase this. That was a good lunch. Okay. Now, SOAP. Let's go back here again. SOAP. So, we live in the assessment. Okay. So, you have, what was that again? Family history. What else?
Social and past history.
Social history. Past history. Okay, keep coming.
Review of systems.
Review of systems. How many systems of the body are there? 11. There are 11 systems of the body. What else?
History of present illness.
History of present illness. Remember that CC, that onset, that what's bringing you in the office today. Okay, and what else? Chief complaint. Again, same thing. CC, onset. Okay, maybe you had this 1 or 2 weeks ago and you still ain't better. Rolaids ain't fixed it. So the doctor got to do a what? Upper GI to see what's going on. Do you have GERDs? Maybe. Okay, now, all of this matters when you are doing coding. All of this matters when you're doing coding. This helps you complete your judgment along with the doctor on his outcome. Outcome being the what? The 2 kind of codes. What are they again? Diagnosis and procedure codes. Very good. You all should have learned that in electronic health records, because we had electronic health records, I think, with the last group that left out. Yeah. We had electronic health records and we had computers in the medical office. So y'all should have learned this. All this is going to be found in the objective. Who's having the conversation in the objective? The patient and the doctor. The doctor and the patient. Very good. Do y'all see? I'm trying to help bring relevance to why this is important. Why you need to know this. This is not just a vicarious thing or information. It's important to know this. Now, will you memorize all of this? No. Will you be familiar with this? Yes. Will it become a part of you over time? That's my prayer. To be just as passionate about this as I am. Nerd! All you nerds, unite, say yes. Say yes to being a nerd. Okay, nobody want to be. Thank you, Ashley. Thank you, Ashley. Nobody wants to join the nerd union. Okay, fine. It be Ashley. High five, girl. Thank you. We ain't gonna talk to these over here. We're just gonna let them talk to the hand. Talk to the hand. Talk to the hand. Okay. All right. Next question.
This is a descriptive elements that can be documented in HPI. Location, quality, severity, duration, timing, context, modifying factors, associated signs.
Okay, very good. Very good, very good. Okay. Victor, next question.
Place the body of systems that are recognized for reporting or reporting of review systems. Constitutional, eyes, ears, nose, mouth, throat, cardiovascular, respiratory, gastrointestinal,
Itinerary,
musculoskeletal,
integumentary,
integumentary, neurologic, psychiatric, endocrine, hematologic, lymphatic, and allergic and immunologic.
Okay, very good. So all 11 systems of the body are listed there. Okay. Now, let's look at something right quick. Let's suppose the patient CC is, and CC means what? Chief complaint. She got a stuffy nose, and it's running. She got itchy, dry eyes. Her chest is congested, and it hurts when she coughs. I mean, she's just being in a lot of pain. Her head hurts. She get headaches. She feel like she just want to take her head off her shoulders and switch it with somebody else. Okay, so these are chief complaints. Okay, now, stuffy nose. What system of the body does the nose deal with?
Respiratory.
Well, kind of, not really. Ear, nose, and throat. Ear, nose, and throat. That's the ondexia. Ear, nose, and throat. This is dealing with the doctor that's called a what? Otolaryngologist. Otolaryngologist. Ears, nose, and throat. Somewhere up in there. Okay. Itchy eyes. Again, Endexia. Endexia deals with the eyes. The eyes are kind of right up in the same place where the nose is. It's kind of in the same place where the ears are. It all has some sort of drainage connection to the what? Throat. Gotta think about your anatomy physiology. Okay, so Endexia and okay, so we already got one review of systems. All right. Chest congestion and it hurts. Now, what system of the body is that? Respiratory system. Very good. I'm so happy. Respiratory system. Okay, that's another one. Her head hurts. Who deals with that? What system of the body deals with that? Neurology. Okay. So 3, review of systems. The doctor has to check these areas that is within his or her scope at 9 times out of 10 a PCP. A PCP consists of family practice, internal medicine, that's a medicine for adults only. Like pediatrics have doctors for kids, adults have doctors for grown-ups. Those are called internal medicine. General practitioner. Sometimes your OBGYN, depends on your circumstance. If you're pregnant, then you have to come to the OBGYN for everything. From Tylenol to cough syrup, because why? If you're pregnant, you're not taking medicine just for yourself. You're taking medicine for who? For the baby. Because you're affecting the baby too. It's not just about you, baby. It ain't about you no more, Ashley. It ain't about you, baby. I'm so sorry. Hate to break your heart. It ain't about you no more. Okay? All right. Because you tomorrow, I want to Honda. It's just me. Okay. All right. So now we got 3 review of systems. So let's kind of do some probabilities. 3 out of 11. 3 out of 11 systems of the body will be reviewed. Why? It all depends on the CC. Now, if the CC had one more issue that dealt with another review, that dealt with another system of the body, then it would be 4. Because the doctor don't need to do all 11 just to get a determination of diagnosis. He should be well trained enough to know, I need to target respiratory, I need to target neurological, and I need to target indexa, ear, nose, and throat. Because I'm musculoskeletal, that's not important. Skin, she ain't got no bumps and stuff. Okay, that ain't important. She ain't asked me to feel on her lymph nodes, so that ain't important. Do y'all understand how that works? Okay, very good. See, by the time I get through with y'all gonna think like physicians. Okay, number 21. Who was the last person? Okay, Ashley.
Is it 21 or 22?
21 pumpkin.
Problem focused examination is a limited examination of the affected body area or organ system.
Very good. That's one of those variables that you're gonna learn. Well, y'all should have learned. Yeah, y'all should have learned. Well, we can talk about it again. Hold on. Remember, for procedure codes. Remember, there's different types of procedure codes. What book gives you the procedure code? CPT. CPT has divisions of the codes, right? They have what? Evaluation and management. That deals with your new patient. That deals with your established office visits. That deals with your hospital visits. That deals with your home health visits. If you've seen a midwife, deals with that too. Okay? Then anesthesia. We'll talk about that another time, how to calculate anesthesia claims. Anesthesia. And then they have their P modifiers. Okay? Their P modifiers. Their P modifiers, P1, P2, P3, P4, P5, P6. That means you dead. You on a ventilator. They're trying to keep your body alive and breathing for what? For transplant reasons. And they make good money. Bills make good money working for anesthesiologists. Okay, then you have your surgery codes. Your surgery codes. So let me go back to this. Your E&M codes go from 99201 to 99299. Your anesthesia codes go 00100 to 00199. Your surgery codes go from 1,000 or 10,000 to 69999. Okay. Then you have your radiology codes. Okay, that's like your X-rays, your MRIs, your PET scans, your CAT scans, your echocardiograms, your treadmills, your Holter monitors, all that beautiful stuff. So radiology codes go from 70,000 to 79,999. Pathology is your CBC, your white blood cells, your lipid panel, your HIV, your cultures. Also, it goes with pathologies of biopsies, fine needle biopsies, different kinds of forensic type stuff that you need, BRAC analysis. All that is pathology. Okay, that's those high level pathologies. That's the pathologies that be like $1,000 or $2,000. Your CBC may be like $65, $70. And they go from $65, $70 to $2,000 or $3,000 to $10,000. BRAC analysis costs me $5,000. Okay, so going right along like this, and you have 80,000 to 89,999. Then you have your physical therapy. All this place. All right, baby. Have a good day. Did you finish everything?
Yes, I'm working on week 3 now. The rest of the
okay. I need to give you week 3. Did Vanessa come get her stuff? Not yet. Bless her heart. Bless her heart. I can't give you that just yet. Can you come back? Can you come back to me on Monday?
Yeah, I can.
You sure?
Yeah, I'll make sure.
You positive?
Yeah.
You're not lying to me?
No, I'm not.
I know you're not. All right, sweet pea, I'll see you then.
Okay.
All right, so you have the medicines. All right, so you have physical therapy. Physical therapy goes from it's not, yeah, 9,700,000 to 9,7999. Okay, then you have chiropractic. So if you're gonna work for a chiropractor, chiropractic go from 98,999 to 9,999. Yeah. No. Wrong. 000 to 9,899. Okay. And then you have your vaccines, your regular vaccines, MMR, DTaP, varicella, all that good stuff. All that is in the 990, I think it's, yeah, 9900 to 99999. Hey, sweet pea, how you doing?
I'm good.
Good, bless your heart. I know you are, baby. That's all your skag right there. Okay.
Yeah. I need to get home and do this.
Okay, baby. Okay.
Yeah, my first, it was my 5-year-old that started, and it's now my 2-year-old.
Yeah.
And I'm just hoping the 7-month-old doesn't catch
I know. Oh, bless your heart. You take care of yourself.
me. I know I'm tired.
I
No
know
sleep.
you are. I know. I'll be praying for you, love.
Thank you.
You're welcome. You're good. Bless your heart, baby.
Thank you.
You're welcome. And at chapter 4, I already wrote your note on there what to do with that chapter 4.
Okay, this one?
Mm-hmm.
Okay.
So work in your workbook. Follow me on the tube when you get a chance, and work in your workbook, and then the rest is just all on you to do.
Okay.
Okay. If you have any questions, just text me or call me. Well, text me because I'm usually better with text. I'm sorry. I'm better with text. Okay, baby.
So am I. I'll see y'all later.
Okay. Thank you, darling.
See y'all on Monday.
All right, baby. Vaccines, DTaP, MMR, all that good stuff. I can't remember all what I was saying. Huh? Yeah, yeah. Hepatitis vaccines. Don't they get vaccines for hepatitis? Yeah. Oh, yeah. Especially if you're working in a healthcare setting. Yeah. I had to keep up to date with that when I worked at MD Anderson and Memorial Hermann and Methodist. Yeah, I had to keep up with that. Okay. Who was the last person? Oh, Ashley. Oh, you read though, right?
Yeah. It's your turn, Rick.
Oh, it's her turn. Okay, go ahead.
Medical decision-making, MDM, as the process is performed after taking the patient's history and performing the examination which results in a plan of treatment.
Okay, very good. That problem focus, that MDM, that's why I was going with all this. That's why I was mentioning all this. So you have variables. You have variables. The variables help determine, not variables, because we're not talking about algebra. We're not talking about algebra. We're talking about procedure code. Variables help determine how you choose your E&M codes. Okay. And some other codes. For example, like standalone codes. We'll talk about that a little later when we practice code. We'll come back and visit that. Okay. Diana.
Any charts that are amended with additional notes must be labeled addendum or date entry dated on the day of the amendment and signed by the physician.
Signed by the physician. Do you make the correction? No, because why?
What?
Do you make the correction?
No, because it's out of our scope.
Because it's out of your scope. And I'm not talking about the mouthwash. Okay. All right. So Miss Harper's going to stop right there. Time is it? I hear the thunder, lightning. I think so.
Rain.
The rain. Mhm. All right. Do y'all have any questions for me? No? Okay. Well, this going to end our session. Y'all have questions for me? You know what to do. Make comments, although I don't read them. Unless you email me. Make all the comments you want. I don't care. Anyway, I do care. But anyway, thank y'all so much. What was it?
I said, now we know.
Now y'all know. Okay. Now they know. Okay. Thank y'all so much and have a wonderful evening. Bye.